get started, good morning, welcome, and thanks for coming to learn about dementia. It's something that will affect most of us sometime in our life, either directly or indirectly. The presentation today is sponsored by Stephen Ministry. As you may know, it requires 50 hours of training to become a Stephen Minister. But that's not where the learning ends. We have continuing education and decided today to share some of that continuing education with the congregation when it's a topic that makes sense. If you remember in May, we shared hospice and palliative care presentation with Amy Weatherup, and at that time we learned that dementia is the most of the patients now in hospice and palliative care have dementia. Used to be cancer.
It's our number one diagnosis.
Number one diagnosis, thank you. And so anyway, as soon as we got through with that, we said, hey, we need to talk more about dementia and learn more about that from the Stephen Ministers. And it's such a good topic, we thought we would share it with the congregation, anybody that wanted to come. So we invited Amy back, and she graciously agreed to come back again. The crowd wasn't too tough the first time, I guess. And
I got them warmed up for
we're
you.
glad to have her again today. So I'd like to reintroduce Amy Weatherup. She is the strategic account manager at VIA Health Partners, the largest hospice and palliative care provider in the Charlotte area. Amy has worked in healthcare for 33 years, including long-term care, senior independent living, hospice, and home care. She has a postgraduate degree in thanatology. I mentioned last time I had to look that up. It's the scientific study of death and the losses brought about as a result. She is a certified dementia dialogue educator and a certified deaf doula. One of her duties with VIA Health Partners is to provide education to the community, including courses in dementia, communication with dementia patients, difficult behaviors of dementia patients, team building, morphine myths, personality styles, end of life symptomology, and psychosocial needs at end of life. Amy has taught sociology and social justice at the college level, and in her free time, Amy enjoys cycling, hiking, and photography. She has 2 college-age sons and a COVID puppy. So please, and a new kitten apparently, since May, a new kitten. So if you will, please welcome Amy.
I'm going to sit today. People who were here last time know that I'm going through treatment for multiple myeloma, and I'm very fatigued today. So I'm going to sit down. If I feel better, I'm going to get up and walk around a little bit, because usually I move when I talk. So, dementia. The one thing everybody's afraid of, right? Most people, when they think of dementia nowadays, think of Alzheimer's disease, and there's a reason for that. About 90% of all people diagnosed with dementia have Alzheimer's disease. And for years and years, we were told that it couldn't be diagnosed until postmortem, when they did an autopsy on the brain and could see that the actual physical changes that happen in the brain becomes pounds and pounds lighter during, believe it or not, during the disease process of Alzheimer's. And I'm just going to show you this. I don't know if you'll all be able to see it. I should have made copies for everybody. But this is what your healthy brain, this is what all our brains look like right now. All here, how it's all full and out, and you know we have like a level of fluid between our actual brain and our skull. When you die from Alzheimer's disease, this is what your brain looks like at autopsy. So you can see how it's actually physically shrunk, and there's all these dark spots where the brain has died. And this is like crossways this way of the brain. So it's really scary, actually. And for years, they did a ton of research on the plaques in the brain, because they've always talked about those plaques that they find in the brain of Alzheimer's patients. And it appears to be almost like an obstruction in the brain, and all that research now, they found that that probably isn't what it is, so they're starting over and looking for something different. they found that the plaques, which are made up of proteins, same proteins that you see in the brain of a patient with Parkinson's disease, that in actuality there may be some positives associated with those plaques. So now they're starting over to see how they're going to work differently, but maybe they don't want to try and get rid of those plaques. Okay, so can anybody name a kind of dementia besides Alzheimer's disease?
Lewy body.
Lewy bodies. And so that is often associated with frontal lobe dementia. A lot of people will get both Parkinson's and Lewy bodies together. It's what Robin Williams had when he died. He had Lewy bodies dementia. And that's what, maybe what Bruce Willis has. He has some kind of frontal lobe dementia. But yes, that's one, and that's one that's pretty obvious and very different than other kinds of dementia and very easy to diagnose because some of the main characteristics of it is that it appears much like psychosis. They have actual visual hallucinations and they have audible hallucinations along with the confusion, but different than psychosis, the hallucinations aren't scary. And surprisingly, a lot of times they see either cats or children. Nobody knows why, but that seems to be the common thing that they see. So you may have a dementia patient who, I told the story last time I was here, first day in a new nursing home working as a social worker, I saw a lady and she told me that there had been a cat in the courtyard the night before and I spent half the morning looking for the cat and there was no cat. She had frontal lobe dementia and thought she saw the cat or dreamed she saw the cat or saw the cat. Just nobody else could see the cat. They tend not to be very aggressive or problematic. It's just that they have these delusions. However, they're a huge fall risk because their vision is so poor and because they're having issues with their vision and the part of their brain that's processing vision, they are very unsteady on their feet. So you have to be very careful with that type of patient. Okay, can anybody name another?
What about CTE?
So CTE is not officially diagnosed under dementia yet, and that is the brain damage that you see in professional athletes, a lot of boxers, football players, showing that type of thing. It is considered brain damage, but to this point they haven't listed it under, but it does show a lot of the same things. They have a lot of memory issues. They tend to have a lot of the symptomology of frontal lobe dementia in that they show impulse control issues, and a lot of them develop alcoholism, gambling problems. We've heard about people with CTE committing violent crimes, and it's all tied back to that damage. The difference is with CTE, when you get a concussion, your brain slants around in your head, so it's damaged all over the brain instead of in one specific area. So that's a little bit different. But a lot of head trauma that happens to people, car accidents, falls, that kind of thing, is the frontal lobe, and the same idea as CTE. So yes, that can be it. Any perpetual damage can cause it. Probably one everybody knows of somebody who has, and that's vascular dementia, and that's caused by stroke. So when there's limited blood supply to the brain, usually in one of your veins that runs up the side of your neck, it's why they do all those tests and then rotor up people's big veins up their necks at later in life. When you have vascular dementia, it affects one very specific part of your brain, either where that blood clot was in your brain or where the damage was done, and that part of your brain actually dies. However, your brain, each part of your brain, and I'll show you this too, all the parts of your brain have different jobs. So the frontal lobe of your brain is vision and vision processing and verbal, and it is reasoning and processing. So if you have a something vascularly happens and it affects the front of your brain, it's going to be different than if you have vascular dementia that affects one or the other hemisphere of your brain, which is what you see a lot with stroke when you see somebody who has one side of paralysis or their mouth hangs down on one side. Your brain has all these specific jobs in the different parts of the brain. However, the beauty of therapy in those situations is that you can train the brain, another part of the brain, to take over and learn how to do something. In fact, in epileptic patients, they actually cut the communication sometimes between the two sides of the brain, and each side can operate completely independently. And what it's able to do is, so if your brain is damaged right here, and this is affecting the left side of your body, then all the cells around that part of your brain that controlled, say, your fingers, they're trying to, your brain is trying to teach them how to do that. And so you can regain losses that you have from vascular dementia, which is why it's so important for therapy to start and continue and to be as intensive as possible. With verbal, you may see somebody who has vascular dementia that at the beginning they aren't speaking a lot, and then they'll begin speaking again, or they have issues with word finding. Big thing after a stroke is the issues with the ability to find the appropriate words and use the appropriate words. Again, that can come back and improve over time. Okay, anybody, can you think of another? It's harder now. There's actually 7. Yeah.
One of the catch-alls I hear is senile dementia.
So, yeah, and dementia isn't really a diagnosis. Dementia is, it's like saying, it's like saying cancer. Okay, so I have cancer is different than I have a specific kind of cancer. So dementia is a huge umbrella that has these 7 different kinds of diagnosis that you can have based on what the disease process is. And that's a catch-all phrase, and it's something that we use actually in hospice for dementia patients when we don't have a physician who has said specifically that a person has Alzheimer's disease. That's a catch-all that's used as a set of symptoms that you see in somebody. And so some of the symptoms you see are changing cognitive status, change in the ability to have language appropriately, loss of memories, the struggles with everyday living, remembering how to do your own self-care and things like that. That's what is covered under dementia. So it's just a catch-all. Like how we say Kleenex even when they're the brand that's not Kleenex, it's the same idea, okay? I'm gonna look these up because I don't wanna quote any of them wrong. So nobody can think of another kind of dementia? Nobody? Can anybody think of anybody who has, famous people who have had dementia? Besides, come on. Not trying to be funny, but some presidents.
Ronald Reagan.
Yeah, I was hoping you'd guess the right one. Good. Okay, so, yes, Ronald Reagan had it. And actually, Rosalind Carter, that was her diagnosis when she went under hospice as well. So, just recently, Glenn Miller, I'm sure y'all know Glenn Miller.
Sean Connery.
Sean Connery. Probably a lot more people than we know. And most people who have Alzheimer's, and we'll get more specifically into that in a minute, but when you're talking about Alzheimer's, most people have the disease for 10 to 15 years before they're diagnosed. Because we have the ability to make changes in our everyday life that can hide it. And I think I talked about this last time too, that there's always an increase in home health companies, home care companies going into someone's home, admissions to assisted living and skilled facilities, and new diagnosis right around the holidays. Because families come into town and spend more than a few hours with somebody and see a significant change when they're in their environment, or when that person is removed out of their environment into your environment, and now they're somewhere that's not familiar, and you start to see the way that they've been covering for themselves. People will do things like say, come into a room and somebody will say, what have you been doing? And they'll say, you know, because they don't remember. Or, do you know who this is? Of course I do. but they never name the person. But there are ways that people cover up, and if you're just talking to somebody on the phone, you can't necessarily pick up on that. And I will be honest with you, physicians don't pick up on it because anybody can pretend for the 15 minutes that they're in the doctor's office. So you'll see that once families come around, particularly around the holidays, there'll be a big increase. Okay. So we have frontal temporal, which is the frontal lobe, Lewy bodies, which they have listed separately, so we only have to come up with 4 more.
Could you
That
just say that Louis, whatever that is, can you spell that or something?
Lewy bodies, yes, it's L-E-W, body, B-O-D-Y, because Louis is the name of the guy who discovered it. Okay. And then there's something called CJD, and that is what we all used to be afraid of, mad cow disease. That causes dementia as well.
It's what?
Mad cow disease.
Oh.
Parkinson's has an associated dementia with it that isn't necessarily tied to Lewy bodies, although I said they do go together, but that usually presents itself. Like my father has had Parkinson's disease for about 18 years, and the neurologist has told him if he were going to get the dementia part of it, it would have shown up already. So that's very hit or miss, and I think it's probably, again, Parkinson's is a tangle of proteins in your brain that aren't communicating right with your nervous system, so it would depend on where those tangles are that would affect whether or not you end up with obvious dementia. Huntington's disease, does everybody know what that is? It's an awful disease. But that again, that's actually inherited. Most types of dementia are not inherited, not even Alzheimer's. I hear people say that a lot. My grandmother had it, my mother had it, so I'm gonna have it. Not necessarily. And I think as this more and more testing comes out, and DNA testing, where we're able to identify the gene that recognizes if you're gonna get Alzheimer's or not, who would wanna know, but we do have one. It's not considered to be genetically passed from generation to generation unless it is one specific type that comes out of one specific family in one specific country in the Eastern Bloc. So the other Alzheimer's we see and the increase that we're seeing now, or dementia that we're seeing increased overall, but Alzheimer's in particular, is because we're living way longer than we used to. The brain gets tired, and we are exposed to so many outside toxins that we don't know what it's doing, the long-term effects of the brain. The amount of metals that we ingest into our body, just the things in the air and the things that we're exposed to, there hasn't been enough longevity for them to know how much that's affecting it. But I think mathematically it has to do a lot with the fact that people are living so much longer. In fact, on any given day right now in the United States, 70 million people have Alzheimer's. It's a lot, and they're very expensive to take care of. So I think that there is a real drive in the government and insurance companies to find some way to keep moving forward with all the research, because it's so expensive. Alzheimer's patients in particular have an inverse relationship between having a diagnosis of Alzheimer's and having other medical complications. They tend to be very healthy and live a really long time. And so the amount of time that somebody is living in a skilled facility in this country with Alzheimer's disease at $8,000 a month adds up quick. And you know, we were all raised and taught to save money and be ready for retirement and all that stuff, but honestly, the ability, particularly of the generation of my parents, who are now 88, to have saved enough money to care for themselves month after month after month at $8,000 a month was very limited. And so most of it comes from Medicaid, and when we hear people complain about how the Medicaid system is running out of money and it costs so much money and all these single mothers with kids, it's the older people living in nursing homes at $8,000 a month. Because you figure if a nursing home has 160 people in it, and maybe 30 are private pay, that means 130 people are using tax dollars to live in a nursing home. And how many of you understand how Medicaid works when you pay for long-term care? Okay, so it is basically when somebody is on Medicaid, they have spent this down to the fact that they don't have a lot of savings. They don't count your house. even if you're not living in it until post-life. But they do that so if there's a surviving spouse, that the spouse doesn't lose the house. So those people will receive their Social Security check and pay their bill. So if their Social Security check is $1,200, then they get to keep a little bit of money, the rest of the money goes to the facility, and then Medicaid pays the rest. So it's a lot of money. Okay, so. Then there's something called Pick's disease. It's one of the least known. Again, it affects the frontal lobe and is progressive. So Alzheimer's is progressive, Huntington's is progressive, Parkinson's is progressive, vascular is not. The damage is done and that's it. Now you can have multiple strokes where there tends to be more, but it's not progressing. The brain doesn't continue to die around it. It's just that one spot that will die and the rest of the brain is awake. And then there's something called Binswager's disease, which except for when I'm teaching, I've never heard of. It's very uncommon. And it's multiple infarcts, which, you know, that's also what they call the heart attack. So where the brain just stops working and it like stops working deep, deep, deep in your brain, which is different than most of dementia that's happening kind of on the surface of the brain. Like you saw the Alzheimer's brain shrinking. That's mostly on the outside of the brain. Okay. Got it?
What is Huntington, just real quick?
So it's a neurological disease and it is genetic, and the worst part about it is with every generation that gets it. So if your grandfather had it and then your father had it and then you have the gene, you get younger when you start showing symptomology, and it's dementia, so there is the confusion part of it, but it's also the body kind of stops working, and most Huntington patients end up living on the floor. I hate to say that, but they don't even sleep in a bed because they fall so much that it's just easier for them to be on the floor. They have almost no control of their physical movement or anything. And I think the horrible part about it is that people know they're gonna get it because anybody who has a parent who has it gets tested genetically, and you have a 50-50 chance. So if you have two children, the likelihood is one knows they're gonna get it and the other one has to live with the fact that they know they're not gonna get it, but the other one's gonna get it. So it's a really, really hard disease. They don't live as long. They have a much lower life expectancy than a patient with Alzheimer's disease. It's really hard to watch.
Have you ever read the book, The Other Dr. Gilmer, or know about this case?
I have not.
It happened in North Carolina, and it was a doctor who murdered his father and was sent to prison. It's very complicated, but it turned out he had Huntington's disease.
Mm-hmm.
It's kind of a mystery, but it's a true story.
Mm-hmm.
It's a really good book, and it's a lot about how they.
I bet he was already a bad guy because most Huntington disease patients are violent. I mean, it's not like that kind of thing, but it may have been that he was angry because his father probably passed it to him, I would say.
He didn't know he had it.
Oh.
He just had dementia, and it's real complicated, but it's called The Other Dr. Gilmer. It's really an interesting book.
There are some, thank you for bringing that up, I appreciate that. But there are some really good books out there. Maybe some of you have seen the movie Still Alice. That was a book first about a woman who knows she has Alzheimer's disease. That one is made up, but there is a true story book called Living in the Labyrinth, and that was written by somebody who had Alzheimer's, and the perspective of knowing that you're losing your mind and that you have the disease and what it feels like. It's very difficult, and probably people have had it for a long time before we realized what it was, but honestly, an Alzheimer's patient loses the ability to care for themselves. So that might have been the old person that they found deceased in their home and nobody was exactly sure what happened to them. And the honest fact is they stop being able to care for themselves. They don't know how to cook, they don't know what a fork is, they lose the ability to identify anything. So,
What about hearing, loss of hearing? Now, is there any association that, that promotes it, or, is there any connection between loss of hearing and dementia?
no. Probably more is, I would suspect if you see somebody who appears to be suffering from dementia but has heavy hearing loss, that you might have somebody who isn't able to interact with the outside world the way they used to. And perhaps they're trying to guess at things that people are saying to them, rather than admit that they can't hear what the other person is saying. I've not ever heard of that connection. And Alzheimer's doesn't seem to affect specifically hearing, where Alzheimer's disease does affect things like vision. There's a true stage of the disease where their optic ability to process declines. I haven't heard it about hearing, but maybe it's because so many people already have hearing loss that they've not made that connection specifically.
There's a commercial on the radio about an audiologist that says that there is a connection.
Yeah, and a lot of times, there are several people in, there's actually one in Charlotte who's an audiologist whose office is in the Arboretum, and she does a lot of cognitive testing, because people who think that somebody is actually cognitively impaired, they find out that it's a hearing issue. And speech therapists also do it too, because there is some misunderstanding about it. And a lot of things can cause dementia. A lot of things can cause dementia temporarily. Has anybody ever tried to come out of anesthesia? Bet you had dementia. Didn't know you were already awake 3 hours ago and you're waking up again. That's dementia. Terrible dehydration can cause it. Medications can cause it. Being on too much medication can cause the same symptomology that falls under this huge umbrella that we call dementia, but it's considered reversible. Head trauma can do it. People with concussions have memory loss. They have the inability to think. They have, there's a lot of things that go along with a concussion, but that's considered reversible, because your brain, like every other part of our bodies, do have the ability to heal itself with proper rest and care. So, other things that can cause short-term dementia-like symptoms.
High fever.
Sorry.
High fever.
I can't hear.
High fever.
Hope I don't have dementia. High fever. She said high fever, and things like what did somebody say?
Urinary tract infection.
Those are fun, aren't they?
Classic.
The first thing that you check whenever you go to visit somebody and they're out of whack and screaming at you is like, we're gonna get you a URI and see what's going on with you. Yes. I haven't heard that cholesterol can do it, and the problem with cholesterol is before you start seeing any symptomology from cholesterol, the damage is done. You know, when they've got you on a statin, it's because they're trying to keep you from reaching those levels, because I think a lot of that cholesterol damage is permanent, which is why, but that certainly can lead to a vascular dementia, because cholesterol is what can clog your arteries and cause a stroke. Yeah. And now, funny enough, I forgot what I was gonna say. I was gonna point out one more thing. That's a kind of common time that we see that people appear to have dementia. Maybe when they have a hangover, that kind of thing. So there are those kinds of things that you can see people come out of when you look at huge dementia. So if you're starting to suspect that you have somebody who is presenting and you have concerns, first of all, you're never gonna get the person to admit it, right? You're just not. Because it's, number one, very hard for us all to see. Who hasn't used the term, I'm having a senior moment? We've all used it. Senior moments aren't a natural process of life. There's always a reason for it, whether that be over-medication, UTI, infection, some other underlying disease process. So never write it off when you see somebody changing, that's just the normal processing changes that happen as you age. There's always, it doesn't mean it can cure it, but there's always some other reason. It's a symptom more than anything else. So investigating to find out what is really going on can be important, because sometimes it can be as easy as changing a medication or getting the right medication, or stimulating people. Grief in older people also often presents itself like dementia. Because, yes?
Do you have an awareness of developing dementia? Or, so personally, you're living every day when it starts to progress? Do you have an awareness and you know that's what's happening?
So, speaking specifically to Alzheimer's disease, because that is again, the largest diagnosis and the type that is most progressive, the person absolutely does. The likelihood that they're gonna let you know that they have that is not very high. Again, because if you think it takes 10 to 15 years to diagnose somebody, that's because in the early stages of Alzheimer's, the changes can be very slight. And researchers have said that perhaps things start showing up as early as in people's 30s, and they don't realize that that's what it is, that they're starting to show some signs of the early stages of Alzheimer's disease. And I will go over the stages of it and how long each of those stages usually last. But the scary thing is, the first thought that I think of when I say it shows up at 30 or 35 is how exhausted I was raising children at 30 and 35. And I certainly can think back to times where, you know, you lose your keys, you lose your phone, you almost lose your children. You know, all the things that happen to you that we all write off of. I'm tired, I'm overworked. We are the most stimulated we have ever been in our culture right now, between, you know, getting in the car, turning on the radio, and your phone is there. And I watch my college-age children who sit in front of their computers and are playing a game with their headphones on, with their friends, and have another monitor with something else going on. I don't know how they do it, but they can do it all day long. And so our brains are so used to that stimulation that as we get to a point where we're not as stimulated, which is where I was heading, sometimes what appears to be a dementia isn't. So, grief. All the same symptomology. Not sleeping well, usually doesn't eat, forgetful, depressed. All those things can present themselves like dementia. And a lot of times doctors aren't really proactive at looking at somebody to determine whether it's grief or dementia when it's an older person. What are you gonna do about it? I mean, if the medications that are available right now for Alzheimer's disease only work if they're given very early in the process. Once you get through about halfway through the second stage of Alzheimer's disease, the medication isn't really doing any good anymore, because all the medication is trying to do is slow down the process of memory loss. So, the other thing about Alzheimer's is that once you lose it, you never get it back, much like Parkinson's. Once somebody loses the ability to do something with Parkinson's, they're never gonna regain it. It doesn't go back and forth. The worst thing that ever happened to Alzheimer's disease is the drama that they've created around it on TV shows, like these people who suddenly wake up and know who they are and say goodbye to their families and then they die. That does not happen. That does not happen. The ability to touch those parts of the brain are gone, because what happens is every single person with Alzheimer's disease degresses exactly the same. Not exactly the same time frame, not in exactly the same way, but in exactly the same stages. If I had dementia and you were my husband, and I go into the nursing home, and when you first come to visit me, I recognize you as my husband. And then as I start to lose my memories, you would come to visit me, and I wouldn't necessarily know who you are, but I would think you are my dad, because now you're coming to see me, and my only memories are as a younger person, and you're an older man, but I know I love you, so now I think that you're my dad. And then as it progresses even longer, you probably become a grandpa. And everybody does it the same, because every time you have a memory, our brains are so amazing, but every time you think of something, you create another pathway to that memory. This is why we often don't forget our children's names, right? Because we say it so many times that every time we say it, we're making a new direction to it. So, when people say to me, how come my mother can remember her best friend from kindergarten, but she can't remember what she had for lunch? Because she made one connection about what she had for lunch. And if that's where her brain is damaged, that connection isn't gonna go through. but she's thought about that friend from 5 years old millions of times. So she has millions of connections in her brain to get to that memory. So if she can't get to it here, she can get to it over here. And so every person that you watch will do that. And it's, when it's not you, or it's not your family member, or somebody that you care about, it's fascinating to watch how everyone goes through the same thing, and to understand how our brain actually works and makes memories and all of that. And I'll stick on Alzheimer's for one more moment, and then I'll go back. I talked about this last time too. The most amazing thing is that Alzheimer's patients eventually lose the ability to have spoken language. In order to be on hospice under an Alzheimer's diagnosis, you have to be speaking 6 or less words. Like, you lose the ability to communicate. The ability to word find goes away, and then language becomes more simple, and then they start calling things by the wrong name, and they can't identify things. The worst thing you can say to an Alzheimer's patient is, "Mom, do you know who this is?" Don't do that to somebody. They don't. Just say, "This is Sue." "Oh, Sue." No, don't. It's like setting your children, like when you know your kid's lying about something and you set them up to lie to you, don't do that. So as they're going through this thing and losing all this language, and all the complications that go along with it, they've discovered, and you've probably seen this, that they put headphones on Alzheimer's patients and play a song that they know the words to, and they'll sing every word. Because where we store our memory of music is in a completely different place than where we store our memory of language, which is why that ABBA group could sing in English even though they didn't speak it, because you're learning it in a whole different part of your brain. That's something to think about if you're ever with somebody, and it's not just playing music, which is one of the shortcomings of having somebody in a long-term care facility, is they do a lot of music in those places. But they push everybody into a room, just like you guys, and somebody stands in the front and sings. And a lot of people will sing, but if you have a very advanced Alzheimer's patient, they need to have headphones for some reason. They aren't sure what the difference is, but for some reason, maybe because there's no other stimulation or outside noise, that enables that part of their brain to interact. And if you've ever worked with somebody who has a learning difference or a learning disability, you'll see in the way that they train people to do things. Like if you have some processing issues, they've learned that if kids read out loud, they're more likely to comprehend and get reading comprehension than if they read to themselves. And it's not because they're not reading it to themselves, it's because when you read out loud, you're stimulating multiple parts of your brain and offering it different ways to remember. So that's why they're telling you all to do Sudoku. I hope you do it every day. I do all the puzzles that they offer me on the New York Times app, because again, teaching your brain and that repetitive of math in particular and word finding and all that is so important to stimulate your brain. And that is what happens with a lot of older people, is they are not being stimulated. All these people who are isolated in their own homes, COVID was horrific for this, that people just weren't getting out and getting any stimulation. And the amount of it that set in quickly coming out post-COVID, because those people hadn't been stimulated for 2 years, was amazing. And so again, keeping people active and stimulated, and I would never recommend that somebody place somebody in an assisted living or a skilled facility if they could keep them home, but there are wonderful adult daycares, there are wonderful groups that you can get people active in, and it's not even just interacting with you, it's true interaction like we get every day of our lives as people out in the world working. Okay. Questions? Any more?
Is aphasia a kind of Alzheimer's, or is it just a symptom?
So aphasia is actually the inability to speak the words that you're thinking. And so it is a breakdown between what's here and what comes out. And so aphasia can be associated with people who have all kinds of dementia, because it just depends where the brain is being affected. So you're seeing, that's what they're actually saying about Bruce Willis. I think they just don't wanna use the term frontal lobe dementia because you usually don't have aphasia with nothing else, and from his appearance, it looks like he has frontal lobe dementia. It is, because that's kind of where our processing is, it makes sense that aphasia would go along with that. But I've seen a lot more people who have vascular dementia who present with aphasia. And so Alzheimer's patients will do it towards the end too, and that's why it's so important when you're the caregiver to really know who you're taking care of, because you'll say, are you in pain? And they may point to their left knee, but it's really their right foot. Like they just can't get to what they really mean. It's just the ability of the brain to continue to process. And that's all executive functioning, which unfortunately, for whatever reason, is right here in our brain. So a lot of the CTE people and people who have falls and car accidents present with a lot of executive functioning issues, and that presents itself in those as well. So I would say a symptom. Okay. And we're already running out of time because I talked too much. All right, so risk factors. Oh, let me give you all the numbers though. Let's see. Do you want to know if you're in the risk factors?
Make my day.
So when it's genetic, this is interesting. So when it's genetic, and we were talking about whether or not it's actually genetic and early onset, which is what they usually call the genetic passed on kind. So, you know, I think the youngest person ever diagnosed was in her early 20s. In England, she was planning her wedding and people blew it off, but she was just forgetful because she was planning her wedding and she actually had early onset Alzheimer's. You have to have 3 gene mutations to have that kind of diagnosis. Now that being said, you also have to have a DNA mutation to get multiple myeloma. And I'm the only person in my family who has it. And they don't know if the gene mutation is from birth or if it's caused by exposure or something. So it doesn't mean your parents passed it to you. It may mean that your gene started reproducing wrong at some point when it was reproducing itself, okay? All right, head trauma. So lots of head traumas, CTE people or my child who has had multiple concussions. Lifestyle risks of smoking, excessive alcohol, unhealthy diet, and physical inaction. So it's funny because I feel like that's for everything. Like, do you remember that they said people who were overweight were more likely to get COVID and more likely to get it worse, and that people over a certain BMI could get not vaccine, but like their flu thing that they have if you get, you can't just get it if you're a healthy person and you get COVID, but if you're overweight and have a certain BMI, you can get the medication that's like their flu. And I'm not sure if it's that people who tend to smoke and excessively drink also tend to be overweight. You know, it's hard to know what's the cause and what's the effect of weight and things. But I feel like those poor people always get lumped in as having the worst outcome, so take it with a grain of salt. Okay, so presentations that you will see when the ways that Alzheimer's can present itself. Don't be scared now. Confusion about time and place. That's the most common one. I think that's when people tend to identify somebody as having Alzheimer's disease. We hear the stories about mom went out in her car and got lost and couldn't find her way back home. It's pretty common that's when people will start to take it seriously. You find weird stuff in the refrigerator or in a cabinet or that kind of thing. Not the things I do, like I'm walking out of my house and I walk out without the drink of coffee that I just made and is sitting on the coffee maker. That's distraction. But it's the finding stuff in weird places or getting lost. People who tire easily, mood swings, we all have these, lack of judgment, we all have that, trouble with finances. And it's not that they have trouble with finances if they've always had it, it's if you see a change. Somebody who's always been able to manage their money and suddenly they're paying the mortgage 3 times in 1 month. Or they're paying, you know, they're not remembering that they've done something, or they don't pay it for 4 months, that kind of stuff. Those changes. If somebody's still working and memory loss affects their job, which is why FYI it's scary to think about a president being diagnosed with Alzheimer's disease, when we all know now that you can have it for 10 to 15 years before somebody diagnoses you. Not saying that Ronald Reagan had it in office, he 100% did, but not saying that he did. But even if you're being checked by a doctor and they knew he had it, the likelihood that they're gonna tell anybody, right, from a security standpoint isn't gonna happen. But based on how long he lived with the disease post-presidential, he for sure was showing symptoms when he was in the White House. We'll just talk about history. Okay. Then, forgetting appointments, isolating themselves, and people will isolate themselves because the large group will become overwhelming, right? Because they don't remember people, they can't follow the conversation, people might ask them a question that they can't answer. Those might be the first, which we all have, which is why it's scary. Okay, then the second types of things that you start looking for is the more progression, that they can't be left unsupervised, that they're restless. A lot of people talk about how much Alzheimer's patients are awake at night. It becomes very problematic when you're trying to care for somebody that they mix up their nights and days. And I don't think they really understand why that happens, but the agitation that happens at the end of the day that they call sundowning, they used to tie it to people worked and now it's time to go home and maybe that's what it is, but now they're starting to think that people are just exhausted by the end of the day, so their ability to kind of keep control over all the things that are the external outcomes of their disease process just aren't being, they can't control them so much anymore. And then the restlessness leads into people being up all night. And honest to God, this is the biggest problem. Because how can you be at home with your mom all day while she's awake taking care of her if you can't sleep at night because she's awake all night too? And what happens is they're catnapping. I hate to say they're like babies because I don't want to say we should treat them like children. But they sleep in short spurts. They'll be asleep in their wheelchair and then you go into the kitchen and do something and they're awake and you come back and they're asleep. So that's why they're not sleeping at night. They just don't get a restful REM cycle ever. And so in New York, they have opened up the schools at night and they have overnight daycare. So that you can have your loved one at home and then they go there at night and you sleep and then they come back home to you. Brilliant. Because they're doing it because it's cheaper than putting people in a nursing home, but for people who wouldn't rather have their person with them than in a nursing home, particularly the way that whole mess is going right now. So it's a really good idea. I only have 5 more minutes, don't I? And I'm only okay, you're gonna have to let me come back someday because we didn't even get through like anything. So I really didn't get through any of these pages about dementia. So I wanna make sure that if anybody came here with a specific question, what I wanna say is, if it walks like a duck and quacks like a duck, it's a duck. So most likely, if you're interacting with somebody and you don't know that they've had a stroke, they probably have Alzheimer's disease. There are so many resources out there. We have a wonderful Alzheimer's Association here in Charlotte. I actually do education for them at the police department. Isn't it wonderful to know that at least the police are being educated on how to interact with people when they come into contact with them. If you are caring for somebody, or if you have a neighbor that you check on, or somebody from here that you're concerned about, there are a lot of things that are important to do. The Alzheimer's Association is wonderful for resources, and thanks to COVID, you don't even have to go to in-person support groups anymore. Everything is online. You can go in person if you want to, but you can also go to learning sessions online. They have a ton of education listed on their website. The things that they offer can help with any kind of dementia, But if you're told that somebody has vascular dementia, again, the presentation of that is gonna be very, very different. What you see is what you get versus Alzheimer's disease, that's gonna be progressive. There are stages of Alzheimer's disease that are terrible. Everybody goes through that stage where they're swearing like you've never heard the words coming out of their mouth before. The sweetest little church mom you'll think she's in a saloon. And it's because every single thing that we've encountered in our lives, thought, seen, witnessed, is all stored in our head. It's amazing. It's all there. And when you have Alzheimer's and you start losing that ability and those executive functioning and impulse control things, that's more likely to come out. And when your language is going away and you're frustrated and you're losing your ability to be independent, she was always thinking those words in her head, she just wasn't saying them out loud. And now the ability to control saying it out loud goes away because we all control it. You know, I say that to my kids all the time. My dad swore deep ban. I'm from Connecticut. It's like an adjective. I mean, it's not like down here where people don't swear. My kids heard it, and I would say to them, I can't tell you, you can't say it, but you can't say it at school. Like, you know, you have to be able to control certain things, and that goes away as Alzheimer's affects itself. There's also a very uncomfortable stage with every Alzheimer's patient where they become very sexualized. It's very hard on families, very, very hard, because a lot of times a spouse will have a living spouse, and they also have their boyfriend or girlfriend wherever they're living. And it's very, very difficult on the spouse, but that person has no memory of the spouse at that point. They don't remember they're married. They don't remember that person. And it's good for the patients because they're feeling love. And that's the one thing with this disease that doesn't go away, and why, through my husband, and I started to not remember him. I still remember the feeling. I know that I love him, and I know he's an older man, and who are those people who are older men in my life that I love through my life? Children will tell you that, oh, he came to get you. Okay. Children will tell you that the relationships stay the same. Like if the mom had a contentious relationship with one daughter, even though she doesn't remember, she still has a contentious relationship with that daughter. The love doesn't go away. Remember that. That's important. I'm so sorry that I didn't talk faster.
Thank you very much, Amy. Thank you.
Thank
you. Thank you again. We'll have you back. See y'all in service. Thank y'all for coming.
Start at 7.
Yeah.
Thank you.